Welcome to the Red Room with Fat Fabes. I'm your host, Fat Fabes. I like how my name's like tied up with the title of the show. It only matters when you're in the Red Room, and today everything is going to really matter because I've got a very special guest. This guest, I mean, how do I say this? Her name is Dr. Shilpa. She is an obstetrician and a gynecologist. I can pronounce gynecology very well. Obstetrician is a bit hard. It's like a tongue twister. And she is from Prince Court Medical Center. So welcome to the show, doctor.
Oh, thank you so much for having me.
You look amazing.
You're so nice.
No, really, every boy that you gave birth to, he's a happy baby. You know what I mean? He's like, is this what I'm coming into the world for? Wow. Thank you, mommy. No?
They're all happy babies because they don't know what they're getting themselves into.
That's true. 5 years down, they see a picture. That's my doctor, mommy. They're still happy. What got you into this field of gynecology? I mean, was it the fascination for the
hoo-ha? No.
Hoo-ha? Or you wanted to know more about it? I mean, a lot of us want to know more about it. I've been married for 27 years, right? And every time my wife and I, we have a little bit of adult time, I can still hear whispering in the background, you still haven't got it.
It's hard to find what you're looking for. But,
okay.
But having said that, to answer your question, I actually knew I wanted to be a doctor for women from the time I was 8 years old.
Okay, wait, hang on a minute.
Yeah.
So you are Dr. Shilpa Nambiar. Mm-hmm. You are Indian.
Yes.
I am Indian.
Yes.
From the time I was 5, I was told that I wanted to be a doctor.
For women or for
No,
men?
I was told that I wanted...
You were told?
Yeah.
Yes.
Because we've only got 3, you know, doctor, lawyer, engineer, right? I thought doctor was quite scary because, I fainted at the sight of blood. But I didn't know I could do this. If only I knew back then, right?
So...
Right.
I was the opposite.
You
My
wanted
parents
to be a
didn't
doctor.
want me to be a doctor.
Really?
Well, my mother secretly wanted me to be a doctor. But
Okay.
my father thought, you're a girl. You should do a job where you can focus on your family. And being a doctor is very
Let me guess.
demanding.
Teacher.
That's what he wanted me to be.
I know what is going on in this world.
But I wanted to be a doctor because, and you're going to find this a bit funny, but so from the time I was very young, I was fascinated by the world around me, how everything works,
Wow.
The ball rolling down the hill or why the wheels turn.
Right.
Some people might say autistic, but I don't think so. But I was just fascinated and I wanted to understand how everything worked.
Right.
And then you realize actually there are human beings who are walking, talking, thinking, and
Breathing.
all of this is powered by chemicals, reactions in your body, machinery that is not plugged in.
Get your books out, boys and girls. This is going to be a long one. You need to write notes. We go. Okay.
And we're not plugged into anything.
Absolutely.
Electricity, I can understand. But this was amazing. And if I did something that could understand not just how the human body works, but also how to fix it if something happens, I mean,
Right.
what more power is there in the world?
Right.
And I wasn't really interested in how a man works. I was interested
Thanks.
in how I work.
You're like, who cares, right?
I
okay.
wanted to be a doctor for women, basically to understand what was going on with me,
Okay.
other women who might...
But of all body parts, you went
Um,
focused on, you could focus on women's heart health, women's mental health, women's...
But the uterus is the powerhouse. The uterus and the
Right.
ovaries are the powerhouse that drives everything in the body. The heart, the bones, the brain, everything.
What 5 hygiene tips would you give a lady before coming to see you?
To see me.
Yeah.
Well, I would assume that they would have some basic hygiene courtesy when they come and see the doctor. So like brush your teeth and have a bath or something like that. But
Supposed to do that?
But if you're talking about grooming and hygiene down there, it's not really necessary. I mean, it's not like you got a clean house because you think I'm coming to visit.
Visitors are coming, boy, clean the house quickly. Right.
So, I mean, some women come to me because they've got a vaginal infection. And I want to see that discharge, the color, the smell, the texture. I mean, these things are informative for me to make a diagnosis to be able to treat you.
And when you see someone like that, right?
Yeah.
Are you able to go for lunch right after?
Oh, yeah. It's completely clinical.
Wow.
Yeah.
Wow.
I've been doing this for more than 25 years.
You have? Okay, you look like you just got started.
You're such a darling.
Oh, man. Okay, next question then. So, you heard her. You don't have to clean house.
No. And if you want to talk about cleaning, actually, you don't even have to clean the vagina. It's got a self-cleaning ecosystem. Good, bad, everything all sort of in balance. And when it is not in balance, then you come to me with a problem, and I want to see that problem so that I can help.
What was my wife talking about? She should watch this episode. I want to talk about women and pregnancy and once you go through all of that, right?
Women and pregnancy?
Yeah. Once a woman gets pregnant, they give birth. Here in the Asian countries, it's so important to, do the right things. Stay at home, eat the right food, keep your womb warm. Don't eat things that are cooling, and all of these things. My sister was in America. Her colleague went to give birth. 1 week later, she's standing at the office door, and my sister's like, "What are you doing here? What, aren't you on confinement? What's going on?" She's like, "What confinement? I'm feeling fine." And she's back at work. But here in this part of the world, it's a big no-no. Is it relevant?
It is very relevant. Mm-hmm. And although...
Or are you only saying it because you're in Asia?
No, I worked around the world, right. And I know that, yes, women in Western countries don't have as much help. Yep. And after delivery, they go right back home by themselves with maybe just their partner to help them. You underestimate the effect that pregnancy has on the body.
Okay.
So it's actually been compared to athlete training 24/7 for 9 months. That's how much of a strain you put on the heart because you're growing a human being,
Absolutely, yeah.
And it is tiring. Mm-hmm. And the joints change, the way the heart changes, the circulation changes. And when all of this is done, it's not really rest either because now your body has to prepare milk for this newborn.
Baby, yeah.
It's not really nothing. And it takes a full 6 weeks for everything to go back to almost normal. Now, in other countries where they don't have this confinement, even confinement sounds a bit like jail, right? So modern women will say, "Oh, why do I have to go and be secluded in some
let's
place?"
be politically correct.
But
you choose to stay at home for your health.
Yes.
Period.
No, that's exactly it.
Right.
It is recovery.
Yeah.
It is nourishing yourself. I mean, the principles around the confinement period are valid.
Okay.
Rest, recover, have good nutrition, be clean. Yeah? And you need it. And I feel that whether you like it or not, as a modern woman who thinks I've got it all, if you don't take that time to recover, it becomes very difficult later on. I mean, you put a lot of strain on your joints and mental health is
but
the
there are
area.
People in the world who never heard of the word confinement. They take a break for sure. Some of them because they need to take care of the baby, so they take a break from work for 6 months, but not the way we do it. You got to wrap your stomach lah, you got to take herbs lah, you got to do all of these things, which I don't think you can find these kinds of things in some other
Probably
places.
not, but also because there isn't this inbuilt support, you can see that postpartum depression is a lot more common in countries where they haven't sort of taken care of themselves or taken that break. And here, like it or not, yes, your mother is forcing things down your mouth, but at the end of the day, you're getting support. You're getting someone to help you with the baby. You're getting someone to feed you.
Yeah.
It's all good.
It's all good in the hood.
So
okay. Now, so what is the right technique for, ensuring a woman's health after pregnancy, before pregnancy? What's the right technique? Is there a right or wrong technique?
The amazing thing about nature is that a lot of things are not instinctive, but nature sort of gives you symptoms to know how to take care of yourself.
Right.
So during pregnancy, you have, in the beginning, right? A lot of people say, why do I have all this nausea and I'm vomiting, I can't eat anything? But the first 12 weeks are a really critical time where the baby is developing. Everything is growing, the arms, the organs, all of that. And this is nature's way to prevent you from ingesting something that could interfere with that development.
Dude, I never saw it that way. Wow. So, yeah.
So actually, most of the
So
time,
your body is saying no.
don't take anything because, this could cause problems with the way the heart is developing, the way the spine is developing. So the food is not so important. It's more important to get fluids in. Of course, if you're so sick, you're becoming dehydrated and malnourished, that's a different story altogether. But it's a natural way of protecting this developing fetus.
I learn something new every day.
And then you realize that as the body grows with the pregnancy, you will have become very thirsty because you need to increase fluid intake for blood volume, because more blood volume means more blood to the baby.
Right.
You get very tired in the evenings and you want to have a nap. And that's because, and you say, why am I so tired? I never used to be someone who took naps. And it's because when you're sleeping, where's all the blood going? Not to your arms or legs or brain, or where it's going to the baby. Right. So your whole body has programmed it in such a way that this ideal environment is developing, maybe at the expense of you, but if you listen to your body, you will know the right things to do.
Amazing. Now, what about cravings? I mean, I just think that cravings, are they real? Because I know someone who ate so much during her pregnancy when she was not even craving it. She says, my only chance to get fat.
Oh,
and my only chance that I can eat whatever I want to. Is that real? Are cravings real?
Cravings are real, and cravings are not...
Are you going to say is what the baby wants to eat?
I like to say that.
I like durians. How the heck does the baby know what a durian is? Okay.
Well, it's actually... a craving is because you may have some kind of nutritional deficiency.
Right.
So you might crave potassium. You don't have enough potassium, so you crave bananas maybe.
What about stories of women eating sand and chewing on slippers? And
that is called pica. It's a craving for things that are not naturally food, and it's actually a sign of iron deficiency. So you need to see your doctor and see what's going on.
No way. Really?
Yeah. Ice cubes, all kinds of fun.
Yeah. Wow, the sand bit. I've heard about sand. Why would you chew on sand?
Yeah, so it's a nutritional deficiency. Okay. And sometimes it's not cravings, it's aversions. Also sort of guiding you towards what's the right thing to have or not to have.
Can you predict, the gender of the baby by looking at the woman's stomach?
Absolutely not.
Really? No. My mother can.
Of course she can.
Look at that auntie, You see, the stomach is sharp, baby boy.
And she's got 50% chance of getting it right.
I will tell her that and break her heart. You are right, mommy. No, but seriously, a lot of people do that. A lot of people look at the baby. This is so big.
There's no way.
No way?
The way the abdomen looks has got a lot to do with what the woman looked like before she was pregnant. So it's going to be a bit more rounded if she has a little bit more fat around her belly anyway. It doesn't mean it's a boy or a girl.
Yeah, my sister-in-law was well-rounded.
But
she ate everything under the sun.
Yeah, that may be something else.
So far, every question has been a serious question. I thought we were going to have a lot of fun. But, I got into it so much. Thank you for all the information you've been giving us. For parents who are trying to have children for years and years and years on end, what would you say to them? Don't stop trying. Keep trying.
Well, depends on your age.
Doing it wrong.
Depends on your age.
Yeah.
And how hard you're really trying. So when you diagnose or when you label infertility, subfertility, whatever it is, you need to make sure that they're having sex regularly now. They're having sex the right way. You'd be surprised how many people don't have sex the right way.
Really? New topic, right and wrong way. How? Isn't it natural?
No, not always.
This is news.
There was a couple who, bless them, they're so innocent, who were trying for about 2 years. And then, they seem to be young, healthy, what's going on. And it turned out that he was putting his thing into her belly button.
What do I do at this point? I really don't know how to react to this one. For 2 years.
For 2 years.
He doesn't have friends to talk to him about, oh my word.
I don't know. So,
wow.
So if you're doing it right, doing it often enough.
Sorry, I'm shocked.
And it's not working for at least a year, sometimes 2 years, depending how old you are. Then you need to see a doctor to find out what's going on.
I cannot get the image of the belly button out of my head now.
Is it that kind of show?
No, it's not that kind of show. But wow, I never knew people didn't know where to put it. I'm sure.
Now, of course, porn is existent everywhere, so a little bit easier access.
I guess so.
In those days.
Really tough, isn't it? Right, and do you have to sit and explain to them?
Yes.
How?
How do I explain to them?
Yeah.
It's not that kind of show.
I'm just checking. It's like, how would you explain to somebody who's putting it in the belly button and no, I mean... It's like
Pictures.
Diagrams.
Diagrams, pictures.
He might take the diagram home.
He might do that.
Wow. Sorry. I'm sorry. It's nice having you here. You look great, by the way. I mean, is this how you normally dress up? Because, I can tell my wife we're switching gynaes now. Okay. So I've asked you all the questions I wanted to ask you. Is there something that you want to share with the women out there? It's International Women's Day. You were supposed to be here last week, but you were late.
I wasn't late. You couldn't make it on time.
Who couldn't? I? Sounds like something my wife would always say.
I like your wife already.
Oh, yes, you should meet her. Oh. Anyway. So, yeah, what would you want to share with young women, the modern women, the I know everything in the world women? What would you like to share with them?
Well, it's International Women's Day, and I'm glad there is a day where we can focus on women's health, women empowerment, women everything. Makes the men kind of feel irrelevant, but...
Yeah. I don't feel anything, actually.
But if there's one thing I could advise about taking care of your health, it would be look at your genetics and see where you've come from. Because a lot of your health issues that may develop in the future, the kind of screening that you need to do, really depends on the genes you were sort of served.
Right.
So if you come from a family where there's a history of breast cancer, for example, colorectal cancer, then when you get to a certain age, you need to do screening for those things. Or if you come from a family where diabetes is prevalent, hypertension, or what Malaysians are facing an epidemic with is obesity. And obesity is not just a risk factor for every cardiometabolic disease out there, probably every cancer there is out there. No, you're not so bad. You've lost some weight.
Oh, thank you. It's tough to hold my stomach in, though.
So, if you want to maintain good health all through your life and post-menopause, start taking care of what you eat. Keep healthy with exercise, because then if you're taking care of yourself, you will recognize the symptoms that need attention. You will recognize the risk factors from your family that need screening. And I don't need to be the one to give you, these are the top 10 things to do.
You have Facebook and YouTube for that.
Yeah.
Because every other doctor out there is giving advice. All kinds of half of what you said apparently is not true. Yeah.
Yeah, you got to kick me out of this red room.
No, according to Facebook and YouTube. So I'm not taking their word for it. I'm taking your word for it.
Thank you.
Yeah, but the gene thing apparently is not true.
Of course it's true. Everything starts in utero.
There you go. See? If she says it's true, it's true. I believe you. I love this show. Thank you so much for being here, Doctor. Thank you for spending time with us. I actually had a whole lot of other questions to ask you, but I was thinking, you know what? Since you shared so much with us and you were so, you took the time and trouble to tell us a little bit more, and I've learned so much in just this few minutes about women and the things they go through and how beautiful life is, when you get pregnant and how the body works and all of those things. I thought I'll dump all the rest of the questions that we spent 5 days figuring out, right? Yeah, that's Sonal, my producer over there. We sat together, we just dumped the questions, bro. It's all here. None will be used. Oh, I'm calling somebody. Hello. Sorry, I'm calling you. I'm calling my producer.
Siri does all these funny things.
I know. So thank you so much for being here.
Thank you so much for having me.
I hope you had fun.
I did have fun, and I hope you'll invite me again.
Oh, for sure. This time on the radio show.
Okay.
Definitely. We will sit down and talk about a few other things.
Okay,
right.
Good.
So thank you so much. That was our Very interesting episode. Red Room with me, Fat Fabes. Now we all know about the women's human body, not the men. Huh? We don't care about the men. It's just the women.
Not this month.
Not this month. This month is all about the women. And we also know a few other things. I'm going to go home and have a conversation with the wife. We'll see you soon.